Understanding Hashimoto's thyroiditis. Causes, signs, symptoms, and treatment. Hashimoto's thyroiditis, also known as chronic lymphocytic thyroiditis, is an autoimmune disorder where the immune system attacks the thyroid gland. This leads to inflammation and often results in hypothyroidism, where the thyroid gland cannot produce enough thyroid hormones. Here's an in-depth look at the causes, signs, symptoms, and treatment options for Hashimoto's thyroiditis. Causes of Hashimoto's thyroiditis. 1. Autoimmune factors. Immune system dysfunction. The body's immune system mistakenly attacks thyroid cells, leading to chronic inflammation and thyroid damage. Genetic predisposition. A family history of thyroid or autoimmune disorders increases the risk of developing Hashimoto's. 2. Environmental triggers. Excessive iodine intake. High levels of iodine in the diet may trigger the onset of Hashimoto's in genetically predisposed individuals. Radiation exposure. Exposure to radiation can increase the risk of thyroid disorders, including Hashimoto's. Infections. Viral or bacterial infections may contribute to immune system abnormalities that trigger Hashimoto's. 3. Hormonal factors. Sex hormones. Women are more likely to develop Hashimoto's, suggesting that sex hormones might play a role. 4. Stress. Emotional or physical stress. Significant stress or trauma may contribute to the development or exacerbation of autoimmune disorders. 5. Age and gender. More common in women. Hashimoto's is more prevalent in women, especially those between 30 and 50 years old. Age factor. Risk increases with age. Signs and symptoms. Hashimoto's thyroiditis often develops slowly, and symptoms can vary depending on the severity of hormone deficiency. 1. Thyroid enlargement, goiter, swelling of the thyroid gland, causing a feeling of fullness or a visible lump in the neck. 2. Hypothyroidism symptoms, fatigue, persistent tiredness and lack of energy. Weight gain, unexplained weight gain despite a normal diet and exercise routine. Cold intolerance, increased sensitivity to cold temperatures. Dry skin and hair, dry, rough skin and brittle hair. Constipation, frequent constipation or digestive issues. Muscle weakness, generalized weakness or muscle pain. Depression, low mood or feelings of depression. Memory problems, difficulty concentrating or memory impairment. Hoarseness, changes in voice or hoarseness. Menstrual irregularities, heavy, irregular menstrual periods in women. 3. Additional symptoms. Puffy face, swelling in the face, particularly around the eyes. Joint pain, pain or stiffness in the joints. Bradycardia, slower than normal heart rate. Elevated cholesterol, high cholesterol levels, despite a healthy lifestyle. 4. Advanced symptoms, if untreated. Myxedema. Severe hypothyroidism can lead to myxedema, characterized by extreme fatigue, cold intolerance, and swelling. Treatment. 1. Thyroid hormone replacement therapy, levothyroxine. The most common treatment is daily use of synthetic thyroid hormone, levothyroxine, to normalize hormone levels and alleviate symptoms. Dosage monitoring. Regular blood tests to adjust the dose based on thyroid-stimulating hormone, TSH, levels and clinical response. 2. Diet and lifestyle changes. Balanced diet. A diet rich in fruits, vegetables, lean proteins, and whole grains supports overall health. Iodine intake. Adequate but not excessive iodine intake is important. Avoid iodine supplements unless prescribed. Regular exercise. Helps manage weight, improve mood, and enhance overall well-being. 3. Managing stress. Stress reduction techniques. Practices such as yoga, meditation, and deep breathing exercises can help manage stress, which may exacerbate autoimmune conditions. 4. Regular monitoring. Follow-up tests. Regular thyroid function tests to monitor hormone levels and adjust treatment as needed. Physical exams. Routine checkups to assess the thyroid gland and overall health. 5. Supportive treatments. Symptom management. Treatments for specific symptoms like dry skin, hair loss, or digestive issues. Mental health support. Counseling or therapy for managing depression or cognitive difficulties related to thyroid dysfunction. 6. Surgical intervention. Thyroidectomy. Rarely required, but in cases of large goiters causing significant symptoms or compressing nearby structures, surgery might be considered. 7. Complementary therapies. Nutritional supplements. Selenium and zinc might help in managing thyroid health, but should be used under medical supervision. Herbal remedies. Some herbal treatments may support thyroid function, but their efficacy is not well established and should be discussed with a healthcare provider. Hashimoto's thyroiditis is a chronic autoimmune condition affecting the thyroid gland and often leading to hypothyroidism. Understanding its causes, recognizing the signs and symptoms, and knowing the treatment options can significantly improve management and quality of life for those affected. With appropriate medical care, lifestyle modifications, and regular monitoring, individuals with Hashimoto's can lead healthy and fulfilling lives.